My favorite features of the Virtuo Vivo, I have so many. So the first is that it's small, it's easy to use, and it scans very quickly. So you're able to fit it in small places for patients who can't open really wide. And not all the 3D scanners that we have on the market today are able to do that. So the Virtuo Vivo makes it very easy. The other thing I love about the Virtuo Vivo is the fact that it's touchless. So you don't have to break sterility, or you don't have to contaminate the area you're working with or a computer that you're working with when you're trying to use a 3D scanner. So all the parts of the Virtuo Vivo scanner you can clean and sterilize in a clean environment without contaminating that. I also like the fact that the scanner heads are a little less expensive, so if you have to replace the detachable scanner head that can be run in sterilization, it is also not as expensive to purchase the replacement heads. I also like that you don't have to use powder. So we are out of the age of powder and should have been a long time ago. So it's nice that the Virtuo Vivo doesn't need powder to scan for that. You can use it to scan for diagnostics. You can use it to scan for implant impressions, crown impressions, and you can use it for clear aligner cases if you'd like to do a little ortho as well. So you can use it for many different things. So some of the key benefits of the Virtuo Vivo is the fact that it scans very quickly. So you can take an impression on a patient now in less than 15 minutes. And that's including the upper, the lower, and the bite, writing the prescription and getting it immediately sent to the laboratory. The faster turnaround we have for our restoration cases, the faster the patients can be treated. The other thing is that the Virtuo Vivo is very accurate. So I have seated a few implant crown restorations, both cementable, screw mentable, and screw retain restorations, and all of those have fit very well. So it's nice to have a scanner that takes a very good, accurate impression. The Virtuo Vivo has been one of the better scanners for us to use, and the reason it has is that it's been so small. There have been situations where I have started a scan with a different type of scanner and the patient was not able to open up wide enough, or I wasn't able to get the distal of the most distal tooth in a scan. You will run into those situations as you begin to do your digital scans in practice. The Virtuo Vivo, I have run into that much less. The scan is able to cut around those corners a lot easier and is able to fit in the mouths that are a lot smaller. It is one of the smallest heads you will run into when you are looking at digital scanners.